Bonjour, everyone. Good morning. On June 27th, I disclosed for the first time that a cybersecurity incident involving Ontario Health at Home had occurred 3.5 months earlier. A cybersecurity incident that had compromised the personal health information of over 200,000 home care patients in Ontario, at least 1/3 of all home care patients. And despite that, patients had not been notified. When I disclosed this on June 27th, it set off a panicked cascade of events that included setting up a 1-800 number with Ontario Health at Home and finally notifying patients, as is their legal right. At the time, I called it a home care hush-up, and today I am more convinced of that than even 1 month ago. New information today has been unearthed that reveals details into the scale of the incompetence, deception, and frankly negligence that characterizes Ontario Health at Home and Sylvia Jones's failed leadership of our healthcare system. Until today, here's what we knew. On March 17th, there was a cyber attack causing a data breach. On May 30th, the Information and Privacy Commissioner was finally and formally notified of this by Ontario Health at Home. And on June 27th, the public and patients were finally informed of this, only after I made news of this data breach. New information disclosed by Global News today reveals now bone-chilling levels of deceit and mismanagement in Ontario Health at Home and by the Minister of Health. Specifically, we have now learned that it wasn't until April 14th, 1 month after the healthcare systems were compromised, that Ontario Health at Home even became aware of the cyber attack. This is a revelation that speaks both to the lack of security of the database and to the government's lack of oversight of the vendor who suffered the cybersecurity incident. It took a month to find out. And at that time, there were system outages that were impacting information systems and operations. The fact that on April 14th, there were system outages impacting information systems and operations alone should have been the trigger to notify the Information and Privacy Commissioner, a requirement by law that this government failed to follow. Additionally, Ontario Health at Home now claims that they received confirmation that personal health information, such as patient names, contact details, and information relating to medication, equipment, and supplies, was only confirmed on May 21st. This should have been a second trigger to notify the Information and Privacy Commissioner. Yet they waited an additional 9 days before doing so. And they still didn't tell the impacted patients until more than 1 month later. For 75 days, roughly 10 weeks, this government knew that its health databases relating to home care were compromised, that there was a significant risk that patient information had been released. They did nothing. They didn't tell the patients, and they waited for something like 5 or 6 weeks before even fulfilling their legal obligations to notify the Information and Privacy Commissioner.